Hello and welcome to our presentation on Croup. This is done by Jared Scott, Daryl Hawthorne, and Jeff Flack. So let's start out and talk about, first of all, what is croup? As it says here, croup is a swelling of the inside of the throat and obstruction of the upper respiratory tract. It is a generic term encompassing a heterogeneous group of illnesses affecting the larynx, trachea, and bronchi. Laryngotracheitis, laryngotracheobronchitis, and laryngotracheobronchopneumonitis and spasmodic croup are included in the croup syndrome. How is croup caused? The most common type of croup comes from parainfluenza viruses. There are also other types of viruses that can cause laryngotracheobronchitis. Bacterial, fungal, allergies, and inhaled irritants are all other types of croup that are not as common. And who does croup mostly affect? Croup occurs most commonly in infants and children, 6 months to 6 years in age. Adults, teenagers, the elderly, and drug addicts are not as susceptible to the disease, so you're going to mostly see this in children. Let's talk about the symptoms of croup. Viral croup is typically preceded by a prodrome of 12 to 72 hours of a low-grade fever and coryza. It then progresses into the classic symptom of croup, which is a barking cough, sometimes just called a croupy cough. Symptoms are worse at night, causing difficulty for the child and thus the parents to sleep. Also, the symptoms are aggravated any time when the child is lying down as well as when the child is crying. So it's definitely important to help try to keep the child calm and to breathe properly. We'll talk about that here in a little bit with treatment as well. So there's some imaging you can do that may help with the diagnosis of croup. That would include x-rays. As it says here, radiographic evaluation can help in diagnosis, but only about 50% of the time. The classic sign to look for with croup is the steeple sign, which is the result of a narrowed column of subglottic air seen on a posterior anterior view and an overdistended hypopharynx on the lateral view. While radiography may help to confirm clinical suspicion of croup, computed tomography or CT may be more sensitive in defining the cause of obstructive disease in more confusing clinical settings. So X-ray may help, CT is going to help confirm. And here you can see on an X-ray, you can see where the arrow is pointing at the steeple sign where it has that trapped subglottic air, and there's obstruction there, so that can be seen on X-ray half the time, as we talked about before. And here's another case. Also, you can see with the arrow here of the steeple sign seen in croup. So treating croup, you're obviously first going to try to help keep the child calm and help make sure that the child's breathing okay. And if they're inpatient, obviously you're going to be able to use any number of tools to help with breathing. Rarely are you ever going to have to intubate a child with croup, but that can happen, but it's rare. And as it says here, for a long time, for decades, epinephrine was used to treat more severe cases of croup. But recent studies and statistics have shown that glucocorticoids, such as dexamethasone, are associated with shorter hospital stays, improvement in croup scores, and less use of epinephrine. And then oral dexamethasone can be used to treat mild to moderate croup. Also, what people have used for a couple hundred years, maybe even longer, but we know at least from the 19th century, mist therapy in different ways, with humidified air, has been used to try to help people with these kind of symptoms. And then doctors have even said that if you bundle up a child and then take them out into cool night air, that can also help to relieve their symptoms. So that's also a possibility. But mostly, as we go into the prognosis for croup, you'll see that it's usually a self-limiting disease with an excellent prognosis. A very small percentage will require inpatient care, and only a few of those will require intubation. And then death from croup is extremely rare. And here's our sources that you can look at where you can get more information on croup. Hope you learned something and enjoyed. Have a nice day.